Ellis, and I am the program director with Room 217. And this is, in fact, our first webinar of January, not of our season, but of the year. And we're thrilled to be featuring the effects of aging on the auditory system with Judy Keith. And just a little notice, you can go to our website at musiccare.org/learn and find out about our offerings. We've just released a virtual learning studio called Music is Neurodiverse. And here you go, our upcoming trainings. We have a level 3 that is starting now. So if you are looking for a level 3, you can still join. Our next level 1 is coming up in February, and our level 2 is coming up in March. And of course, these are virtual trainings for our Music Care foundational training. And our next webinar is coming to us all the way from BC, February 12th, 2025. It's Songs for Healing and Belonging with an educator and researcher from Simon Fraser, Deanna Jestrin. And this is just if you want to know more about our programming, you can use your phone, take out your phone and do a little bit of a screenshot or the QR codes there. So our Facebook, Instagram, LinkedIn. And also, if you are attending today's webinar and you need CEU hours, please email talbis@room217.ca, and maybe we'll pop that into the chat for you in a moment. But a little bit more about Judy Keith today. She is an audiologist with extensive experience spanning 33 years. She's passionate about delivering exceptional hearing and healthcare to both adult and pediatric populations. Her practice is centered on employing state-of-the-art diagnostic methods and amplification protocols, with a focus on developing habilitation processes tailored to individual lifestyle needs. Her process encompasses medical devices, audiology, team building, amplification, and leadership. Judy holds a Master of Science degree from Western University in London and a Doctor of Audiology degree from A.T. Still University of Arizona. She has a strong foundation in both clinical and business aspects of audiology. She excels in driving business development and enhancing overall care experience. Music to Judy has always held an important place in her life, and she cannot imagine her existence without it. She believes in the deep, transformative power of music, but without the ability to hear, human access to this power is diminished. Her professional role encompasses the treatment of all aspects of hearing, speech understanding, cognitive health, and access to every beautiful sound in life. For this reason, she's very excited to involve herself in our webinar today and in Music Care. And just as a personal note and a welcome, Judy, I'm thrilled for the webinar today as my father wears cochlear implants. So very, very curious to hear more about what today is all about. Welcome.
Thank you very much. Thank you for the introduction. It's really great to be here. I'm just going to get us ready to start. Okay, I think we're good to go. So very pleased to be here today. Thank you to Music Care for inviting me. Today we are going to be talking about the effects of aging on the auditory system. I look forward to sharing with you what I hope will be very useful information for all of you in the different facets of work that you have in dealing with individuals of all ages, but perhaps mostly like myself with those who are in the aging population. So for those of you who are less familiar with what an audiologist is trained to identify, treat, and also manage disorders that are either in the peripheral or central system of the hearing mechanism. We work a lot with individuals who have tinnitus and also balance problems, We engage ourselves in finding ways to prevent problems in these areas. We do a fair amount of counseling and also delve into research for both hearing disorders and vestibular disorders, vestibular meaning balance disorders. I personally work independently in the Peterborough area with two practices. My main focus is with the senior population, but I do see children as well. And I'm excited to have a broad population as well to challenge myself, but also ensure that I am serving those who need hearing care. Without further ado, I would like to talk about the objectives for the webinar today. So today we're really wanting to understand how aging affects the auditory system. We're going to talk about what are the signs to look for with age-related hearing loss, see where there might be some challenges for music perception, and we're going to learn how we can advocate and accommodate for some of the problems that are associated with the changes in the hearing system in regards to music appreciation. I'm going to start us off with a video that's just going to save me a lot of trying to describe a complex system. So I'm going to play this video, and there's a really nice narrative as well. So let me just get this started.
Have you ever wondered how sounds make their way from the source all the way to your brain? Take a trumpet, for instance. When it's played, it makes sound waves in the air. The outer ear catches the waves, which then travel through a narrow passageway called the ear canal. The sound waves reach the eardrum, which is a membrane roughly half the size of a dime. They make the eardrum vibrate, which in turn vibrates three tiny bones called the malleus, incus, and stapes. These bones amplify or increase the sound vibrations and send them to the cochlea. The cochlea is shaped like a snail and is the size of a garden pea. It is filled with fluid, and the sound vibrations make this fluid ripple, which creates waves. Hair-like structures called stereocilia sit on top of hair cells and are grouped together as hair cell bundles inside the cochlea. The hair cells inside the cochlea ride these waves, and the hair bundles are moved. The hair bundle on top of the hair cell turns these movements into electrical signals. As the hair bundles are moved, ions rush into the top of the hair cells, causing the release of chemicals at the bottom of the hair cells. The chemicals bind to the auditory nerve cells and create an electrical signal, which travels along the auditory nerve to the brain. Different hair cells respond to different frequencies of sound. The hair cells at the base of the cochlea detect higher-pitched sounds, such as a piccolo or flute. The hair cells toward the top of the spiral detect progressively lower-pitched sounds, such as a trumpet or trombone. At the very top or apex of the spiral, the hair cells detect the lowest-pitched sounds, such as a tuba. The auditory nerve carries the electrical signal to the brain, which interprets the messages as sounds that we recognize and understand.
Okay, so I hope everybody was able to hear that all right. One key concept that I want us to be thinking about is about the complexity of the auditory system. It's extremely intricate, and really any minor change along that pathway that we just looked at, and maybe some of our discussion later will show us there's even more to it. But any change will have an impact on how sound is heard, including music, of course. The other thing that is important to remember is that when we're talking about hearing, we're not talking about just the ears, we're talking about what's actually being transmitted to the brain and how the brain is perceiving what's been heard. So I'm going to run through the different parts of the ear and try to describe to you the things that can go wrong. At the top of this diagram, you'll see outer ear, and then you'll see middle ear and inner ear. So let's start with the outer ear. The outer ear, which is the visible part, is called the pinna. Now, the pinna is cupped towards the front, and that enables us to receive more high frequency information, which is fantastic. So right there at the level of the pinna, the outer ear, is the beginning of collecting and enhancing sound. Then sound is traveling through the ear canal in the form of pressure. It's a sound wave. And it can encounter any foreign object that might be in the ear canal. Most commonly, it's wax. So as we get older, it's very common to have an accumulation of wax that unfortunately tends to harden. So when this occurs, there's a temporary blockage in hearing. And I say temporary because I see people coming in all the time. They're having a hearing problem. And when I look in, I see, oh, it's wax. We can remove the wax, and how delightful. They're hearing a lot better. And sometimes they don't need anything more. But it's only part of the picture. So there can be lots of other things behind that that are going wrong. Let's shift over to the middle part of the ear. So aside from damage to the eardrum, which can occur, there are three little ossicles there called the malleus, the incus, and the stapes in that order. They're the smallest bones in the body, and they have the role of taking the pressure from the eardrum, transmitting that pressure in the form of a force through those three little bones to the inner ear. Sometimes there are problems with, especially the stapes bone, ossifying, calcifying, not articulating with its neighboring ossicle. And that means that there's a reduction in the efficiency of sound being transferred to the inner ear. There are surgeries to help repair this issue, and the surgeries are called stapedectomies. The condition is called otosclerosis. It's relatively rare, but we do see it. Then in the middle ear, there can be problems with how the eustachian tube is opening and closing. So you see the eustachian tube at the bottom of this graph. Now, the eustachian tube should open and close, allowing for pressure to equalize in the middle ear. If that's not happening well, or efficiently, or adequately, then fluid can build up behind the eardrum. And that fluid, if it stays trapped in there long enough, can accumulate to the point where bacteria grows in it, and that further affects hearing. And that means antibiotics and medication. Now, in the inner ear, we have the cochlea, and you'll notice right to the left and up from there in the inner ear is the semicircular canals. Now, the semicircular canals are responsible for our balance mechanism, and the cochlea is the hearing mechanism. I won't get into it in too much detail because we just saw the video, but there are some problems that can occur in the cochlea, mostly related to high sound pressure levels, noise exposure, very loud music, explosions, use of firearms, for example, noisy hobbies can damage hair cells in the organ of hearing. Sometimes they're hereditary or heritable conditions that create a situation where there's a progressive deterioration in the hair cells in the inner ear. There also can be toxins that affect the inner ear. Sometimes those toxins are in our environment, sometimes they're pollutants, but sometimes when medications are taken as well, the medications can damage the hair cells in the inner ear. Finally, we'll talk about some of the health conditions, which are cardiovascular disease, diabetes, to name a couple. And the big issue here is that there isn't enough oxygen delivery to those hair cells, and therefore sometimes they die off. Then we'll look at auditory nerve, far right-hand side, which is basically taking those nerve impulses from the hair cells to the brainstem and the also the brain, right, the hearing part of the brain. So we've talked about a lot of these issues related to hearing loss associated with aging, but I would like to say sometimes there's a combination of many of these factors that over time, the factors are going to compound, combine, add to the likelihood of hearing loss. So here's a lovely picture done with an electron microscope. The top is showing you inner hair cells, and beneath that are the outer hair cells in 3 neatly arranged rows. Unfortunately, when there is a noise condition that damages the hair cells, they get torn, shorn, obliterated, and you see that in the bottom image. Here's an image of the inner hair cells in the normal inner ear, and then damaged inner ear from medications and those ototoxic effects that we discussed. Now we're going to take that little organ that we just discussed, and we're going to tie it together with sound being processed now to the brainstem and then transferred to each side of the brain through the brainstem to the temporal lobe, which is the hearing center. We're going to spend a few minutes talking about age-related hearing loss. Now, age-related hearing loss is a gradual process. And 1 in 3 adults in the age bracket of 65 to 74 have hearing loss. So that's a huge percentage of this population. And the issue is usually that because it's progressive, the individual's not waking up the next day with the hearing loss they come into the clinic showing. So the changes aren't usually noticed except for some subtle things like missing beepers and timers, maybe missing some of the songbirds or cicadas in the summertime. And oftentimes with these folks, low pitches aren't really affected, so they can still hear. They feel, hey, I still hear, but it's probably that it's other people. They're not speaking very clearly. And we're going to shed light on this because looking at our audiogram, which is right in front of you, at the very top, you're going to see pitch in hertz, which is a measure of frequency, pitch or frequency. On the left side is low frequency or bass, and on the right side is high frequency or treble. Now down the left side, we have soft to loud. When we focus on the middle of this chart, we're seeing that there's speech sounds right across the frequency range. Some of the speech sounds are more low-pitched towards the left, and some are more high-pitched. Also, looking at how loud or soft they are, some sounds are louder, like ba, da, o, ah, versus high-pitched that are very soft, like k, f, s. Now, this is a relic. This is probably what you would even say is analog versus digital, but it's a great little clip with the Flintstones. I hope some of you remember the Flintstones. And it's showing how hearing affects speech perception as the hearing loss progresses. We'll get rid of this momentarily.
1, 2, 3, 4, 5, 6, 7. Aha! You're on my apartment building on Granite Avenue. You owe me $300. Get it up?
Fred, take it easy. It's only a game.
Wilma, I'm just like them big tycoons. I play to win. Now, Barney, pay up or get out of the game.
That's 1 down and 2 to go. Ready? It's your turn.
I don't have any more money either. You got it all.
Then I'll take a mortgage on your orphan's home. Well, come on, take the dice, will you? Don't just sit there like a dummy.
I will not have you talking that way to our guests. Come on, Barney. I think we'd better go home.
A 1, 2.
Oh, it's really demonstrating, I think, in a very clear graphic way that having progressive hearing loss really is having a significant effect on how speech is being perceived. So these are some of the warning signs of hearing loss. It can be simply that it sounds like people are starting to mumble. You have to ask them to repeat a lot. You have to put a lot more effort into hearing, maybe even watch them a little bit more closely, turning up the TV, maybe some ringing in the ears, which is called tinnitus, missing some of those soft sounds, especially when in a group environment with background noise. It's really, really tough. And missing parts of information means that you have to ask for repetition a fair bit. Now, for musicians, we start to see that pitch is compromised. Thought this was a very cute little cartoon illustration. Okay, so what are the consequences of untreated age-related hearing loss? Well, difficulty understanding speech and noise, trouble distinguishing between words, and that means it's starting to get frustrating. Maybe it's somebody else's fault. So interactions with others can become negative and stressful. And sometimes what happens is that people begin to withdraw, they isolate, they start to feel a little lonely because they can't get in the game, they're feeling embarrassed, and in some cases, they'll start to feel depressed, which is a significant issue for many. So when we talk about hearing, it's not really about just the ears. It's about how we're able to connect with those who matter most to us. And maybe even in relation to music, really being able to connect emotionally with the music that we're attempting to enjoy or want to keep enjoying in our lives. Yeah, so loneliness and social isolation are linked to serious health conditions. This may come as a bit of a surprise, but there are statistics, and those statistics are that there's significant health risks for people who are over the age of 50. And according to the Center of Disease Control and Prevention in the US, social isolation itself increases the risk of dementia by 50%. And some of the other risk factors that come along with it are cardiovascular disease, even coronary heart disease, and stroke. Now, what about dementia? Now, this card was developed by the Alzheimer's Society of Ontario, and it's also on the Canada Health website, but it's actually showing us the 10 ways to reduce risk of dementia. And here is one that just really jumps out in that if you happen to have hearing loss in midlife, that can increase your risk of dementia by an average of 90%. So if hearing aids are needed, they should be introduced early because they do make a difference in curbing that progression of cognitive decline. The other point I would like to make here is that it's a great idea to have a baseline test done if you're aged 40, 50, at least 50, 60. Get a baseline test to see what's going on. Now, briefly, what is the relationship between hearing loss and cognitive decline? There have been numerous studies showing that there's a connection, but here we have evidence in recent epidemiological studies that hearing loss may be one of the largest contributing factors to dementia of all known risk factors. And as an audiologist, I believe that We've seen this in patients, but we haven't had a lot of research until more recently. And the question is, do hearing aids make a difference? Will they make a difference in decreasing that risk? And fortunately, in 2023, a study called Achieve was published by a researcher in the US, who's also an ear, nose, and throat specialist, Frank Lin. And the study does show through a controlled trial that hearing aids do make a difference to diminish risk of cognitive decline. So the study, very briefly here to touch on the points, included 977 research participants in the age range of 70 to 84. And these participants were diagnosed with adult onset mild to moderately severe hearing loss, which is super common. And here were the results, that in that older adult age group where there were increased risk of cognitive decline through other indices, like perhaps they had other health issues, they found that using hearing aids actually curbed the decline of loss of thinking and memory abilities by almost 50%. So that was a very helpful study, and just underlines the importance that we're trying to bring forward to the public, actually, in relation to hearing loss and cognitive decline. So we'll just highlight point 3, which is that, hearing loss is very treatable later in life. And it's an important public health target to reduce the risk of cognitive decline and dementia, because our population is getting older, people are living longer, and there are going to be more and more people who are experiencing cognitive changes. So to summarize this portion of our talk today, of this webinar, we'll just encapsulate these points: that humans need social connection, and hearing is an important part of that. Speaking and hearing allow us to really share who we are, what are our ideas and our emotions. And it really is evident that changes in hearing perception affect our ability to be aware of sound, but also to connect with other people. The 4th point is not something that we've discussed, but I want to highlight it nonetheless, and that is that if there is a mild hearing loss, it triples the risk of having a fall. And for every 10 decibel increase in hearing loss, the risk of a fall increases by 140%, which is enormous. So nobody likes to have a fall. Oftentimes, that leads to lots of other problems like pneumonia and other issues later in life. So think about hearing loss. I think a lot of us can relate to this image when we've been around some of our senior loved ones, especially when I think about my parents when they were around, or even others that I see in my office every day. So we're going to shift now to music perception. And some of you might have heard of Daniel Levitin, who is a neuroscientist, and he has written a wonderful book named "This Is Your Brain on Music." And some of the key points in what he has written and researched are that our brains are really sophisticated in extracting elements of music, such as pitch, timbre, rhythm, and pitch changes. And music also stimulates every part of our brain. And music has this ability to make us feel so good by releasing dopamine, strengthening our social bonds, stimulating creativity, problem solving, and making us feel good, while actually improving cognition and memory. There it is again. So this graph here, or illustration, shows us all the different areas of the brain that are engaged when listening to music. Some centers where emotion is engaged and others where it's our response to enjoying the music, foot tapping, dancing. Here's our audiogram once again. And the reason I have this up here is I'm going to show you a typical this audiogram. Presbycusis is an age-related hearing loss. The top left corner, you have almost normal hearing, right? But we see a sliding down of hearing thresholds going into the high tones. So when you're looking at the top red line with the circles, this would be a right ear audiogram. And the sounds that are beneath it are loud enough for that person with the audiogram to hear, while the sounds that are above it or towards the top of the chart or audiogram are going to be sounds that are difficult for them to hear. So again, we have the P, P, sh, k, those sounds, hard to hear. So if I say pat, hat, fat, sat, that, chat, it might be difficult for a person with that audiogram to discriminate. And that spills over into lyrics as well. So when we're listening to music and there are lyrics attached, it may actually affect the clarity. Something to think about. Now the second line is just further hearing loss, hardly hearing any speech sounds at all. Now, if you look at the red line on this graph, it's essentially where the hearing really starts to slide on the previous audiogram. Anything on the left-hand side is an audible sound. Anything on the right-hand side is probably not audible or hardly audible at all. So here we're looking at how different musical instruments are perceived. And we can see a piano at the top. You know, it's a wide spectrum of sound, but there are some sounds that are not going to be heard very well. And not only that, the yellow is showing the harmonics in those musical instruments that make the sound so rich and alive. And some of those harmonics are not coming through properly. So we can look at any of these musical instruments on this chart and see that, yeah, this person's going to have some difficulty getting the full quality of the sound from musical instruments. So here is essentially a breakdown of the changes in the peripheral auditory system and how it affects music. So presbycusis is the age-related hearing loss. It's our audiologic term, and it results in a diminished high-pitch sensitivity over time. And that's associated with the little hair cells in the inner ear becoming damaged, and the impairment results in not having the tuning for pitches. So discriminating between one pitch and another is not very well tuned anymore, and the discrimination is not accurate. So that is a common problem. The other thing is that the auditory nerve, which is transmitting this auditory information to the brainstem and the brain, it loses some of its fibers and functionality. And so when that happens, the processing just is not as accurate anymore. And now getting further on in with regard to changes in the central auditory processing pathways, localization of sound can be another area of difficulty, in that in a complex acoustic environment where somebody's trying to listen to music, it might really be difficult to identify where the sound or the voice or the singer or the instrument is coming from. And a slower processing speed is the result of the neurons not being as quick or accurate in transmitting sound. And therefore, if we're making it a complex signal, that's a lot harder for that already faulty auditory nerve to transmit a complex sound to the auditory brain. So here are the pitch changes that can often occur. And that is that one musical note can start to sound like another. So two different pitches could sound exactly the same. Or you could have two sounds being picked up, but that are confused as actually sounding exactly the same. And a real confusing one is this diploacusis, which is hearing maybe a B on a musical instrument on the right side, but on the left side it's being perceived as an A, which would sound really horrible when the sound actually reaches the brain. So this makes playing, singing, even enjoying music a problem. Now here's Pete Townsend of The Who, and I suspect not everybody knows who he is, but super popular in the 60s and 70s and had a wonderful career as a musician. But he experienced hearing loss, probably a lot due to high sound pressure levels playing his music. But with the hearing loss, he also has ringing in the ears, and he does have abnormal pitch perception. So on his guitar, a C will sound exactly like a B flat. Now, when we talk about timbre, we're talking about the description of the aspect of music that isn't related to loudness or pitch or how long the sound is, but really it's the quality of the sound. Does it sound deep? Does it sound warm? Does it sound bright? Does it sound full-bodied? And when we listen to musical instruments, they each have their characteristic timbre, and that has to do with the how the instrument is made, whether it's made out of wood, whether it's a brass instrument. In addition, how is it made? What's the quality of the wood? Is it a Stradivarius or is it a Chinese-made violin? Now, timbre tells us a lot about the musical instrument, but unfortunately with hearing loss, there may be some confusion when it comes to what that timbre really is pinned to. So it may sound a lot like a trumpet is playing, but it might be a violin. Not sure. And that's the result of the hearing loss. So pitch perception, I think that we've really talked about fairly thoroughly, but yeah, pitch perception is compromised with the aging auditory system in many cases, not all, but many cases. Rhythm and tempo become more difficult. So, keeping up with the tempo can be difficult, and appreciating a tempo might just start to be a little bit too complex for the peripheral and central auditory system. Temporal processing is really where you have to process that complex beat sequence accurately, or perhaps it's a really fast-paced lyric or piece that we're listening to, and it makes it very hard in the aging auditory system to process those aspects with accuracy. Not only that, but listening to speech and music at the same time can start to blur, become very smeared. And if listening to music, for example, in a more busy arrangement with lots of vocals and instruments, the ability to separate those different voices, soprano, alto, from different instruments, maybe you're trying to focus on the violins, that becomes less enjoyable, becomes very difficult. And then timbre perception. Well, certainly the overall depth of the sound, the richness of the sound is just not as good, unfortunately. And the texture of different instruments can be not what you once enjoyed, which is so disappointing and frustrating for some folks. So, having said all of that, we've talked about the hearing aspect, we've talked about the consequences for music, but how does that affect us? Well, we can't really connect with music very well if it doesn't sound very good, if it doesn't sound like the pitch is right or the dynamics are what you expect. So it's hard to engage and really experience the emotional component that we're striving for when we're working with people who are using music as a form of quality of life and therapy. I guess I don't need to say that, yes, fast music and fast lyrics are going to be tough. So slowing it down may actually be necessary for older adults with reduced acuity. And then there's the cognitive decline piece that we've talked about. And that can make it difficult for folks to recognize the lyrics or even familiar melodies. And I think we've all seen those wonderful videos where somebody who's further along with dementia might actually still recognize and remember a piece and sing it beautifully. However, that's not always the case. And think about how this can be a consequence of hearing loss. And with the older population, let's think about some of these issues that are going to affect music enjoyment. So we have to make some changes. Coping mechanisms and adaptations are often the best course of action. And I use hearing aids every day in my practice, and I'm absolutely astonished at how hearing aids have evolved since I started in practice, from analog, which was so many years ago, to highly digital with artificial intelligence hearing aids doing millions of computations per second. These are wonderful things to restore sound quality, frequency, perception, hear speech and noise more accurately. And this is possible with the hearing aids we have today. Not only that, but many hearing aids actually have a music program that can allow you to shift from everyday sounds to a more focused program that will make music sound a whole lot more enjoyable. Now, music therapy, I think a lot of the folks in this group, I suspect, really believe in it. And certainly it's important to enhance the emotional and cognitive well-being in older adults. This allows us to reconnect with music in a more meaningful way. Technological advancements, well, there are some devices that allow for frequency-specific equalization, so bumping some of those higher pitch sounds. But there are also things like remote microphones that can be used, where you can patch in a sound source like music, and you can stream that through Bluetooth to hearing aids, which results in an extremely high quality sound. And then we have Auracast, which is going to be made available in the next 2 to 3 years, we hope. And Auracast will be such a simple little device similar to this, which can be patched into a computer, a TV, a stereo, into even a public system like at an airport. But this will allow for sound even in public places. and music to be streamed directly to hearing aid users' ears. Now, music choices should be adapted as well. So, using more simple structures and slower tempos and music with maybe more specific timbres and lyrics are things to consider. So to summarize, the aging auditory system does experience several changes related to auditory perception, and that affects pitch, rhythm, timbre, and we know about some of the adaptations, and I'll just underline that early intervention is really important because that consistent stimulation means things will work better in the long term. And this is significant because we really want to preserve the cultural and emotional importance that music brings to our lives throughout our lifespan. I do think that we need more research on aging and music. It's a really important intersection, and I think we're beginning to understand, but there's a lot more to delve into to preserve music enjoyment in later life. Personalized hearing technology is something that's going to continue to evolve, and it will become better tailored for older adults as time goes on. Technology is changing super fast. And then if we consider cross-disciplinary approaches, yes, we need a lot more collaboration between people looking at music and hearing in so many different ways. The audiologists, the psychologists, musicologists, neuroscientists. We need to come up with a more holistic approach for improving music perception as we age. I'd love to share this very brief video with you.
I hear the world, a distant memory, the sound of silence surrounding me like a symphony without a score, a perfect storm without a shore. I wanna hear your voice calling out my name, a life-changing noise. I'll never be the same. Let's hear the world like you never did before. Hear the world, let's open up that door. Hear the world, it's time to lend a helping hand. We hear the world, I hear the world loud and clear. I feel its music instead of tears. I hear the world, no ifs and whys, the chant of birds up in the sky. And I hear your voice calling out my name. Now I'm like you and you're like me, we're all the same. Let's hear the world like we never did before. Hear the world, let's open up that door. Hear the world, it's time to lend a helping hand. Everyone sing out across the land. Raise your voice for those who can't be heard.
Corey. So just to wrap things up, maybe something to think about, how is your hearing? Contact an audiologist, get a baseline hearing test, have your hearing monitored. If it's you or somebody you work with or somebody that you love. And there are so many things that we can do to improve music appreciation as well. Thank you. If there are any questions, I'd be happy to take them now. Thank you.
Wonderful. Thank you for such an informative webinar. I really, particularly the video at the end, was so effective in showing the different ways people hear. I'll just get you to stop sharing maybe the screen, and then we can open up and see if people have their hands up. Is there anybody that wants to jump forward with a question?
Hi there. Thank you very much. That was really informative. I've got no background in this field at all, but I am a musician, so that was really interesting. And you were talking about the kind of statistics, well, around falling, which I thought was really interesting. Are there infographics or kind of public health posters with that kind of data circulated at the moment?
Yeah, there certainly are. And I'm happy for you to shoot me an email or send it through Music Care if you wish. I can actually find you some infographics on falls, the risk of
Yeah,
falls. Yeah.
that would be great. And I feel like I've got some good data to give my dad a prod because he has some hearing aids, but he's refusing to wear them. So thank you.
Sometimes you need something that's going to push them over the barrier there and get them hearing again. Yeah, thanks for your question.
Any other questions on the floor? You can post it in the chat or just unmute yourself as Lise did.
Judy, that was fabulous. I work at the Alzheimer's Society, Peel, and we've been really trying to, I'm a music therapist. We've been really trying to set some sound goals and sound standards in our day programs so that we have all the staff aware of how, we talked about presbycusis and all this stuff. And one of the things I was trying to explain to my staff, and it would just be interesting to hear your perspective, because I know that getting a hearing aid once someone already has dementia can be quite challenging because it requires that feedback, just like getting your glasses when you get the 1, 2, and I get overwhelmed with that. Are there trainings for audiologists or to help with, or are there ways that we're finding to be able to help people who have dementia get the right devices?
For sure. And sometimes the dementia has progressed to a point where you want to do something and you want to see how hearing aids will help, because we're still looking for some way to connect with them or hope that they will with others. And it's such an individual process. One of the key things is finding something that's easy for that person to use. Nothing complicated, something very, very easy to use. I'm a firm believer in the rechargeability option on hearing aids so that you don't have to worry about changing batteries. That would be a nightmare. But I think sometimes their caregivers need to be part of the process of the fitting. Not only that, but where there are programs and supports, or sometimes some of these individuals are in retirement homes or in other facilities. I do go in, I do house calls, and I meet with the staff to give them the information so they can support that person so that they can wear their hearing aids hopefully comfortably, but there isn't the worry that something's going to go off the rails, something's going to get lost, or they're not going to be able to use it effectively because they're not inexpensive. But at the same time, maybe we don't need really fancy high-end ones, but we need something very practical for that population.
Thank you. That's great.
And if it's okay, Judy, we've got 3 minutes and 3 questions in the chat.
Okay, I'll be quick.
Okay. Question number 1, is electronically amplifying the music helpful, or does it interfere with hearing aid signals or something similar?
Electronically amplifying
Music.
music can, unfortunately, depending on how it's being transferred to the ears, it can distort. So having the volume up doesn't necessarily help because the acoustics of the room can alter the sound by the time it gets to the ears. But, you know, it's something we all do. I think to a point would be the right answer.
Got it. All right, question number 2. Are there other reasons for tinnitus other than hearing loss?
Absolutely.
Okay.
Yes. So there can be nefarious things that are happening, like a growth in the auditory nerve, or there can be certain medications that are being used that are triggering tinnitus. A whole can of worms there, even TMJ problems.
Hmm.
Okay, so things like that. So that would be something to consult an audiologist and see if there's something showing up that would explain why there is tinnitus.
Awesome. And finally, do you need a referral from a GP to see an audiologist?
You do not.
Ah. And so is it okay if we share your email? We have a few questions in the chat just about to share your email for future correspondence, and I think also for that those infographics. Yeah.
Sure. And a question about TMJ, it's temporal mandibular joint. So problems with the jaw and pain in the jaw. Yes, Judy at earsense.ca. Please share my email address and I'd be happy to answer any other questions.
Great. Well, thank you so much. This was a fantastic presentation. So we're very appreciative, and thank you to our community for coming out and being so engaged on this snowy day in most of our regions.
Yeah,
Have a
thanks so
great one.
much.
Okay, take care, everyone.
Okay.
Judy at earsense.ca. Before you sign off, there's, oh, and also if you need CEU hours, Tanya T. Albus at room 217. Great.
Awesome. Bye, everybody.